There's no health without mental health. There is no health without mental health. There is no health without mental health. And so say all of us. There is no health without mental health. There is no health without mental health. There is no health without mental health. And so say all of us. Hello everyone. Welcome to my regular and our regular Friday tonic, Mind Matters with Dr. Nobi. Some prefer to say Mind Matter with Dr. P. How are we doing? How are you? How has your weeks been? So sorry I could not join last week. I was out of town and I'm back. And I believe we were able to digest and ruminate over some of the things we discussed the other time. We talked about signs and symptoms of emotional illness. And I think we mentioned 10. What are those first 10 signs and symptoms that I said? Check my page. After doing this, I normally post it on my wall. I promise it's going to be very short, maybe 10-15 minutes, so that I don't want to, feed us with so many, because we got the whole world and the time, God permitting us. All right. So we will continue today with signs and symptoms of emotional illness. And I said something, don't forget. When I mentioned these symptoms, because I kept receiving messages from my inbox, oh, Dr. Nubi, are you saying if I just keep to myself, I have mental illness? No. Before my last live, I said things like, all these symptoms I'm mentioning, for you to say that there are signs and symptoms of emotional illness, they must meet certain criteria. They must be causing distress to you or people around you. They must deviate from normal, usual. They must be causing dysfunction. When you don't have time for yourself and you are belabored with some emotional illness, that is dysfunction. We talk about duration. It's for a period of time. So it is important for us to know. So don't just say, oh, so if I have poor memory, and no. As long as that poor memory is affecting you, causing distress, you can't sleep, this and that. So it is important. So don't just see somebody outside and say, the way you are behaving, I think you have mental illness. Only psychiatrists can certify someone to be having mental illness. Any other person that says someone has mental illness has to be checked. Get that fact. The only professionals that are certified to say this is mental illness, they are psychiatrists. We work with social workers, clinical psychologists, occupational therapists, psychiatric nurses to take care of our wonderful clients. And we've already said it here that the fact that somebody is wearing a suit or the person is wearing fine clothes like this does not mean that person has good health. In fact, people that wear clothes and wear suits, they are the ones that are ill most. As we go on, you are going to see that the fact that you are talking, you are speaking good English, you can speak in French and co, does not remove the fact that you are okay. So as much as possible, it is important to know. It is important to know that the fact that somebody is wearing nice clothes or is speaking very well, that does not excuse that person from having emotional illness. It's not everybody, because when we get to, thank you very much for the comments. Oh, I needed to have done this. Oh, Sifo, Femola, Official Tibasam, Rubies and Gem, Abi Sunshine, thank you. Tony Ache, thank you guys for your wonderful comments. Thank you so much. Wow, thank you. I was on here. Thank you, Michael Steen, Sam Kelujo. I appreciate you guys, but because I have very little time, I don't want to bore us. I discovered that people don't like long video, so I try to keep it very short. By 15 minutes, I think we should be done with whatever we want to do, because we always have next week, week after, God keeping us alive. So, but I made one critical point today. I said the fact that you are wearing nice clothes, you are speaking very well, you are going up and down, does not mean you are okay. Sometimes all you need is to have thought problem. And once your thinking is affected, you'll be causing distress to yourself, people around you, you'll be having dysfunction in your place of work and co. So it does not mean that, oh, he's not wearing tattered clothes, he's not picking rubbish on the street, therefore he is mentally okay. No, I think that is settled. As we talk about different conditions that constitute mental illness, that's what we're going to be talking next, after I'm through with all the signs and symptoms. But now we'll continue with the signs and symptoms. Then later we'll be talking about depression, bipolar, schizophrenia, delusions, disorders, agoraphobia, social phobia, panic disorders. We will not be picking them. I will not be mentioning symptoms of each one. That's why you now be looking at yourself. Oh, do I have problem in this area? You'll be looking at people around you. Oh, this lady, I think she has it. Then you can continue to put one and one together, not for you to diagnose, but to look for a way you can get them help. Because many of us are living in denial. Because we can still go to work, wear clothes, we can still perform all our other duties, we think everything is okay. But things are not okay. So today we continue with signs and symptoms of emotional illness. And if somebody is watching the time, you can just tell me if it is 15 minutes. Just say time up. Because sometimes I get so engrossed and I don't know when the time has gone. I want to just do 15 minutes. So let's get to work. The 11th symptom is increased desire towards addictive things like gambling, sex, internet, food, all those things. When you have increased desire, it signs that all is not well with your brain upstairs. Ordinary food, when you begin to eat. Some will eat, then dip their hands into their mouth and induce vomiting. We have names that we call them the bulimia. So all these things. Some will sleep and sleep and sleep and sleep and sleep to the extent that they become very big, oversleeping or poor sleep. So all those things can be in excess, and people can be addicted to some of those things. Yes. So as I mentioned, Happy Sunshine, what about food and sleep? Yes. People can have excessive addictive tendency to just be sleeping, or they be craving for sugary things, they be craving for food and co. Official M. Sega, welcome. Nice to have you around. I recognize your presence. So another thing is, and also drugs. You feel the need to feel high. Someone told me that, oh, I need to take this drug so that when I take it, I love taking, Igbo, marijuana, Colorado. When I take it, it makes me feel high. I'm able to approach opposite gender. I'm able to sleep. I'm able to, it makes my appetite to be. There are other ways. I once admitted a client, he was very serious. He said, before heaven and earth, the only reason he started using marijuana was because it was making him to sleep. Then he got to the clinic and it was making him to eat. And we were giving him something and he was eating very well. So he came to my clinic office and said, what was it? Did this thing look like, a stimulant that was making me to eat? I said, that's vitamin B. He said, what? That he started crying. He said if he had known that ordinary vitamin B complex could induce appetite, he will not do. Some of you say, nah, lie. But I think it was serious. I think he was being truthful. Some of these people, I will talk about addiction. When I get to addiction, to each of these things, food, you will see why people become addicted. It starts from a level of experimental, then it goes to purposeful, then it becomes uncontrollable, then it becomes dependent or addiction. I will mention everything. Today I'm only mentioning signs and symptoms. We have a lot. We're all going to be alive to witness some of these things I'm saying so that you can help someone around you. My duty is to make mental health ambassadors. I cannot do everything alone. But when I make you mental health ambassadors, you will look at that person beside you and you will be able to help. You won't be the type that will be saying, it's an arrow of the enemy. Oh, they have seen his star. We have not even talked about myths surrounding mental illness. All the different myths. Oh, they can bite you and you become mentally ill. Oh, they can kill you. Guys, make it a day with me every Friday. We have a lot to talk about. We've not even talked about myth. We don't even talk about stigmatization. We don't even talk about why people don't. Okay, we talk about why people don't seek help. But there are still things that we have not unraveled. We've not taken some of these things one by one. Oh, God. All right. The next thing is irritable mood. Let me try and do 5 symptoms today, please. 5 symptoms. Irritable mood. When your mood is irritable, or low mood, or high mood, anything can affect your mood. You are just happy for no reason. Fine, it's good to be happy, but sometimes it just become excessive, as if you have taken something high. It may be a sign of emotional problem. You may be breaking down, or you are just down. It's normal to be sad, but this one is in a state of despondency, a melancholy state, a state of as if your whole life is crumbling. Something is wrong. Or you just become irritable and sensitive to comments. You become so sad. Ordinary passive comments, you take it so lightly. What is it? They don't like me, they hate me. Something is wrong. If people are going through depression, they become sensitive to comments. The next thing, this person doesn't like them. The next thing, this person is hammering too much on them. The next thing, this person seems not to even want to see their faces. This shows that something is wrong with you, and you may be breaking down without you knowing. Mood is very vital, very important. And when you are feeling unduly happy, so Dr. Nubiso is bad to be happy now. It's not bad to be happy, but there's some level of when you begin to have factitious laughter. Any small thing, something is wrong. But when your mood is so low, and you are watching film, the next thing or you hear news of something, and you are crying more than even the person that was affected. There's problem. There's problem. You are breaking down because you are now sensitive to comment. You are sensitive to movies, ordinary music. You begin to cry. That may be signs of depression. So you will need to understand mood, or you are irritable. You get angry. You go into rage easily. All may not be well with you. The next thing I want to say is when you talk excessively. Dr. Nubi, what are you saying? Are you saying that I should not be talking again? Okay, so if I talk now, I have mental illness. No, now. But there is a level to this thing. Some people, they talk throughout the night, they talk, they meet strangers, how are you? And they don't know how to stop. They talk and talk. They talk. Something may be wrong. There are people that are very chatty, people that we are not saying, but when this thing is not noticeable, and people are not saying, you are talking too much, what's going on? They talk, they are on call for hours. I once had a patient. This patient called from 12 midnight to 12 the other day. As he's calling, he was buying recharge card, he was spending, buying recharge card. The next day, how are you? I just said I should hear your voice. They talk about 2 hours. Go to the next one. Hello. You don't even call someone. That was how the parent knew that something is wrong. He was buying the child card, he was loading, and he was calling. It's a sign that you're having emotional breakdown. It's very, very important. They're talking out of points. Some people talk out of points. You talk out of point. They are asking you A, the person is thinking of B. It's different from what if I don't understand what the person said? And I said this one, Dr. Nubi, are you saying that I should be taken to your clinic? I'm not saying come to Grace Cottage Clinic, Ilupeju, if you are talking out of points. No. What I'm saying is sometimes it becomes very obvious. Sometimes it becomes very obvious that you are not coordinating. It becomes very obvious that something is not right. They say, your mind is processing that because your mind is, so we call it intrapsychic experience. So many things happen in your mind. What did you say? Or you just mention. Talking out of points is a major problem Okay? Some go to the extent of seeing things others cannot see. It's another problem. Then, you know what? I've seen a client before who said for the past 3 years he has been seeing things others could not see. Guess what? He says it's a spiritual gift. Before we knew it, this person was suffering from schizophrenia. And the partner was supporting him. That, he has gift too. He can see things. He can see things. So it's very important for us to know. Some of these things, because they are so, we call it ego-syntonic or ego-dystonic. There are some symptoms that will be ego-syntonic. That is, you even enjoy it. You will think you have been gifted and that everything is okay. You will be so happy. You will be so happy. And one is going through emotional distress and is breaking down gradually. It's not one day that forget the Nollywood movie you watch, where the mother-in-law will do like this and take one powder and do like this. And the woman that is sleeping will just stand up. Forget the movie. Most of the time, signs of emotional illness, gradually. The person will first of all be feeling like, ask me, have you become mentally ill before? No, but I've connected with my clients and they tell me how this thing starts. Sometimes I see something is happening. Some will now begin to use drugs, alcohol to calm that thing down. Then later the thing will be increasing, to be increasing. The person will know that all is not well. Something is going on. This is not me. That is it. That is it. So forget Nollywood. I believe that Nollywood, they are doing better now. No longer somebody just threw arrow. Let's just do I'm being dramatic this morning. It's okay. All right. This evening, for those who are watching me in Nigeria. So it is important. Some people hear voices of unseen people. But my pastor used to tell me that God says so and so. That is acceptable under religious setting. It is acceptable. When you are in your house and I suddenly say, oh, I can hear something. Yes? Okay, what did you say? Okay. All right. That is a problem. Because I'm hearing things others could not hear. It's different from, a religious leader saying, God told me this, God told me that. That is acceptable within that setting. So you need to understand some of these things very well. Another thing is sudden change in behavior or quarrelsome behavior. A personality that suddenly changes. Someone that used to be very calm now becomes very confrontational. Now becomes very, very defiant. You can see it in conduct disorder, antisocial personality disorder. I'm going to mention all these disorders. God keeping us alive. You are going to see some of these symptoms and now they manifest in different conditions. Today, I'm just telling us all the general conditions that can happen. But when I now begin to mention each specific mental health disorder, I'll be talking about some of the features that when you see, we're able to diagnose and say, this person is likely having this. So it is very important. Decline in occupational activity. The person is no longer interested in going to work. The person does not want to do anything. The person is unmotivated, asocial. The person does not want to socialize. The person just wants to stay. There's no volition. The person is not thinking of what to do. And that happened with one of my clients. Guess what? He dropped out of school and said he doesn't want to go to school. The next, what do you want to do with your life after we rehabilitated him? He said he wants to own petrol station. This man, the father is an ordinary teacher. Me, I'm a teacher. So we use the word ordinary because teachers, they were not well paid. So this person, okay, we'll try to rehabilitate him. We put him in a particular fuel center, a fuel station, to be doing a supervisory function. Guess what? After 2 days, he said he doesn't want to do supervisory role, he doesn't want to play supervisory role. He wants to own the filling station. That is total motivation. So motivation at times is not, I don't want to do anything. You yourself, you'll be mentioning something. Good to see you, Goki. How are you? That's my friend. How is everybody? How is everything? Good to see you, friend. So, as much as possible, a motivation is not you not wanting to do anything. It can occur in that way. I know A family that told me that their boy has been at home for the past 3 years. Go to school, he has refused. Do this, he has refused. What do you want to do? I will do something. I'm working on it. This person has been working on this thing for the past 5 years. That is a motivation. Busayo, good to see you. These are my good friends. Wow. So, as much as possible, a motivation can call. It's a sign of emotional illness. So, if you have any relative, don't just meet every December. December 31st, the whole family will meet. It will be in the middle. Remember the son of who you are. Is this how you want to do your life? You have not been doing anything. Then everybody goes back to Lagos, everywhere. And before you know it, the guy is at home. A motivation syndrome. It's a sign that something is messed up. But unfortunately, we don't see it as mental illness. We just say, yo, that one, he's not serious with his life. He's just messing up with his life. Kosha Kama Jam be collecting money and just be. This guy is ill. It's called a motivational syndrome. They don't want to do anything, no motivation for anything. And they continue to procrastinate. Oh, I'm working on some projects. Asking, what is that project? Vague. So it's not everybody that is wearing tattered clothes that has mental illness. Some are at home, they will take care of the house, they will run the generator, service, they will help. What do you want to do with your life? Oh, I'm working on some program. Then some projects. Then I'll do some analysis. Then when we do the programming, okay, to what end? Nothing. That person is very, very ill. In fact, the illness is worse than somebody that's wearing tattered clothes. A psychotic vagrant person on the road, once you give injection, you take care, within 2-3 weeks, the person is okay. But all those subtle mental illness, people that wear suits, people that wear t-shirts, people that wear jeans, people that go to work, and everybody thinks they are okay, that is when they are very, very ill. And because they are not appearing abnormal to the obvious eyes, people don't get help for them. But their thinking is messed up. Their thought pattern is messed up. They are not thinking right. And they are worse to treat. Because their relative will not even see anything wrong. Because their behavior will be abnormal, but it is still explainable. You can explain it. You can explain it. It's explanatory. And when you have abnormal behavior that but it's not holding. Somebody, I told a parent, I said, your child is ill. They said, but it's not holding machete. It's not threatening anybody. He doesn't wear dirty clothes. He washes his clothes and everything. He goes and he eats in the kitchen. I say it's more than this. This person's thinking. If you talk to this person, we call it viscous thinking. You know that this person is not in this world with us. His thinking is, I don't know how to explain it. I said, this man is ill. But people are waiting for that obvious, he started shouting, he was becoming destructive, he's moving about, walking naked, or he's roaming aimlessly, or he's shouting, he's talking excessively. No. If you are waiting for those symptoms, you may not see in that person. But once you notice changes like this, know that something is wrong. And the last thing I'm going to say today is poor awareness of oneself. Sometimes people are not aware of what they are doing. Sometimes people don't know what they are doing. We call it food or dissociative state, where the person will just be doing things. Some have left a station to another station, and they didn't know. When they get there, where have you been? They said the last thing I remember was I was eating bread. It happened when people have temporal lobe epilepsy. Instead of them to be having convulsion, they will have the seizure. And they can go into few states. Usually it lasts for a week or thereabouts. So when that happens, it is dangerous, because what if it happens to you and you now wander to a place that is dangerous for you? You need to get the person help. Ladies and gentlemen, Mind Matters with Dr. Nubi. I think I promised you 15 minutes. I've ended up spending 20 minutes. What is wrong with me? Let my word be my word. All right. Good to see you guys. Thanks for joining me today. I'm going to post it on my wall. I'm going to send it to different WhatsApp pages. I know many people that watch this thing after, they are usually more than those who join live. I know we are busy with one thing or the other. But the good thing is, expect to see it on your wall. Expect to see it on my wall and on my status page, and also on your own WhatsApp page. I'm going to broadcast it, and thank everybody Goodbye. Thank you so much, Rubies and Gem. Thank you, my sister. Thank you, my friend. Thank you. Thank you, everyone that joined today. Oh, purchased. Oh, thank you. Official Bibeke, Sam Kello, Awesonya, Exclusive Firebreak. I can't mention all of you, but I appreciate you for joining. Till I come your way. Next time, always remember, there is no health without mental health. As you take care of your physical body, make sure you take care of your mental health. Avoid that person that is toxic. Avoid that situation that is toxic. Avoid that place that is toxic. Avoid that job that is toxic. Avoid anything that is toxic. That is how you keep sane. That is how you keep your mental health alive. No health without mental health. Nice one. Bye-bye.